Hello and welcome to Herbalist and Herbs. My name is Harry Chrysikis. Today's video short, Breast Cancer Facts Gray to Black. You'll find a companion article on my website, herbalistandherbs.com. Last year there were about 210,000 diagnosed cases of breast cancer, with about 43,000 deaths. The average lifetime risk for a woman now is 1 in 7. It used to be 1 in 30. It is the leading cause of death for women between the ages of 35 and 55. The average age of diagnosis is 50 years old, which in the area of cancer is very young. The doubling time of breast cancer is one of the fastest of all the leading cancers. And the 4 leading cancers are lung, breast, prostate, and colon. And to give you something to compare against, the doubling time in prostate cancer is 2 years. The doubling time in breast cancer is 3 to 4 months. Now, doubling time is when one cell becomes 2 and 2 4, and it refers to how fast a tumor grows. So breast cancer has the fastest doubling time, which makes it extremely dangerous. If you calculate the amount of time that it took to develop breast cancer and clock it back in a woman's period, you'll find out that problems begin to develop very early. But first, let's go into the idea of how old these cancers are when they're found. Now, 85% of breast cancer forms in the duct of the breast. That's where most of the estrogen receptors are. Now, when that happens, in order for a mammogram to be able to diagnose it or find it, it has to be 1/4 of an inch and roughly 500 million cells. In order for a cancer to develop to that size, it would take roughly about 10 years. Now, when cancer breaks out of its capsule and invades surrounding tissue, it's known as invasive breast cancer. It's known as invasive cancer. In terms of breast cancer, it's known as invasive breast cancer. In order for that to happen, it could take another 5 to 10 years. Now, 70% of newly diagnosed breast cancer is invasive breast cancer, which means 70% of newly diagnosed breast cancer is somewhere between 15 and 20 years old. Now, if you take that amount of time it's taken to develop that cancer, subtract it from the mean age of diagnosis, which is 50, that means problems are developing in a woman around the age of 30 or 35. And this is one of the areas that's not looked at or thought about much at all. In traditional medicines, this is looked at as something very important, and this is true of natural medicine as well. If you look at a woman's cycle, many of the things that women think are normal are abnormal, and that is they have irregular periods, they may pass a lot of clots when they bleed, they may have very heavy bleeding, their PMS may be bad, and it may be a cluster of these symptoms. They have terrible cravings, edema, and you can go on and on. There's probably another 5 clusters of things that can go in there in terms of a woman's having a problem with her period. And again, it's considered normal, and which are completely abnormal. So these are signs that a person's body, and in particular a woman in this case, is crying out and saying that something is wrong. Now, again, natural medicine and traditional medicines in general have looked at this as a very important area, and one of the things that they try to do is to normalize a woman's period. Now, generally, when you've got a bunch of these kind of problems, standard practice medicine gives birth control pills to try to normalize a period. And to me, that's not an intelligent practice in terms of trying to help a woman. There's many things you can do with herbs and supplements to balance out a woman's cycle. And generally speaking, when you get a woman who has a problem, you can do it within 3 to 6 cycles. Now, to go back into breast cancer, as I said, the average age of diagnosis is 50. Many women die within the first 5 years, actually about 1/3. Now, it's very hard to get statistics that are older than 5 years old. That's considered survival time, a 5-year survival scale. However, if that scale was expanded to, say, 8 years or 10 years, you'd see very different statistics because many women are dying after that period. There are also other biases built into the scale and how they measure things. One of them is, if you die in the 6th year, you're still considered a survivor in that 5-year scale. If you die, say, as a result of treatment within the cancer therapy, that is, you get something like adriamycin as well as radiation of the heart, You can weaken the heart to the extent that 7 or 8 years out you develop a cardiomyopathy and die from that cardiomyopathy, in which case you're considered a heart case of death and not a cancer case, which is again skewing the numbers improperly. Now, breast cancer is obviously an epidemic, and it is increasing at the rate of about 1% per year. The facts bear this out, and many the arguments against the idea that things are increasing are based on something like, well, it's because now we have mammograms and you can diagnose many more cases. And as much validity as that may appear to have, many, many more women are dying from breast cancer now, and that indicates to me that there are many more cases of it, whether you have a finer diagnostic tool or not. To go into more detail on this subject in terms of what the alternatives are, you can look into my website. And the idea behind what I'm trying to say is that the combination of natural medicine into standard practice oncology would help a great deal in terms of outcome and in terms of treatment. We would have more success in many of the areas in order to help women with breast cancer, and that preventative programs should begin to be instituted on an earlier period in a woman's life. And as I mentioned before, if women are beginning to develop problems at 30 to 35 years old, things have to begin to be looked at as problematic, leading to other difficulties later on in their life. And preventative programs are possible. Even though the American Cancer Society and the National Cancer Institute both state that there is no known prevention for breast cancer, trying to put the odds in your favor by doing intelligent things is very important. If you want more information on breast cancer and a number of other cancers, as well as a number of other subjects, please go to my website, herbalistandherbs.com. Thank you.